Yeah, I
And
got nothing.
this, during the commercial breaks, led Steve to explain to us that he wanted to be a geologist as a kid.
I did.
And he collected rocks like an absolute nerd.
I had a rock collection until I was like 8.
Boy, how did you not have girls just fawning all over you?
I was 8. 7, I don't know.
Hey, you want to see my rock collection?
We moved when I was 9, and I had the collection up until when we moved.
You know what's great about rock collections is you all have a huge one in your backyard, no matter where you move.
Right, that's true. That is true. All right, let's go to our guest line and bring on our first guest today. As promised, time for our SOS house call with Dr. Kyle Plante. He's a family physician specializing in primary care sports medicine, including the management of sports-related concussions. Dr. Plante, thanks for coming on today. How are you?
Hi, guys. I'm good. How are you?
We're doing great. So we've got a couple of big concussion stories going on in the NFL right now that we want to get your thoughts on. And me being a Bills fan, I'm specifically interested in this Josh Allen story from over the weekend. Watching the game against the Texans, he throws the ball, takes a hit, his head slams to the turf, and then kind of pops up and he goes back down. He's down for several minutes, comes out of the game, and they evaluate him for a concussion. Texans fumble the ball, and all of a sudden the Bills have it back, and lo and behold, Josh Allen misses one play. He's back out there, and I believe it was 6 minutes of real time from when he got up off the turf to when he was back in the game. It was about 2 minutes of game time. My question to you, Dr. Plante, is take us through that concussion evaluation process, I guess, and is 5 minutes of actual time not enough time for them to properly evaluate him for a concussion?
Sure. Good question. And we've been seeing this, more and more, especially in the NFL, but even, in NCAAs and across sports in general. It comes out, concussions are very, very complex. Not every head injury results in a concussion. Patients present very differently, from an injury which looks to be kind of a similar mechanism. And sometimes the mechanism looks really, really bad, and the patient comes off the field and has no obvious symptoms. And sometimes the injury doesn't look that bad, and they develop pretty severe symptoms. And so it's tough just visually to identify, did this impact cause a concussion? So the diagnosis of a concussion is a clinical diagnosis, and what that means is that it's based on the physical exam, signs that we observe in a patient, and the symptoms that they're reporting. And so there's, to be clear, there's no imaging, there's no blood test, there's no that will definitively tell you right then if there is a concussion or not. So there's some point-of-care testing solutions that are currently being worked on in the concussion research world, but nothing has been made available to do this. So all in all, it's a very difficult process sometimes, and it's a lot of subjective type symptoms from people who don't want to tell you the right symptoms quite, all the time. And so the way we diagnose is, on physical exam. So we do a lot of things where we track eye movements. We track their balance. We take into account the symptoms that are being reported. So, often you'll hear light sensitivity, sound sensitivity, headaches, vision changes, nausea, that kind of thing. And then there's some tools such as there's something called the SCAT, and so that stands for the Sports Concussion Assessment Tool. That is a standardized tool that you can have. Players will often complete it prior to a season, and so that you have baseline scores, and then you can administer that on an iPad, in one of the tents on the sideline or back in the locker room, and compare some of these testing to see, how close they are to their baseline. So they go through memory assessment, symptom evaluation, some cognitive and neurologic screening, balance screening, and some of the things that are kind of hard to hide. And so, some of this can take, a good amount of time, but some of it is not always needed either. And so it's hard to comment on the specifics of what go on inside that tent on the sideline because you're not there. But I can say I've certainly been a part of conversations like that where, people come in and these players, as you see them and what their normal is. And you kind of go through a quick, brief, assessment of, does this person need more assessment? go into the locker room, go do the scat, go do, this or that, or are they okay? And so that's it's a very tough topic to kind of go over and to really explain sometimes. But it's all that to say that it's a very difficult assessment, and it's going to be unique to each athlete and each patient.
In the moment, they deemed him okay to go back on the field, and he finished the game. And we see it's very public with the blue 10, and it's all right before our eyes there that he's being evaluated. Would it be standard operating procedure to evaluate him a day or two later as well after suffering a hit to the head like that, even if he had no symptoms in the moment? Is it possible? I believe it's possible, right, to get some symptoms a day or two later. Would you expect that they have evaluated him since then?
Absolutely. And I mean, honestly, probably others on the field that day too. In the training room, we often see people who come in and say, I don't recall a specific hit or feeling, any type of way yesterday when I was playing, but I woke up today and I have sensitivity to light. I feel nauseous. I feel off balance. And you'll kind of catch concussions that way. They can take a little bit of time to fully develop. And so that's another, kind of aspect of it that can be really difficult to interpret, in the time. And so certainly would have been evaluated. And a lot of these symptoms are hard to hide. A lot of these exam findings are really hard to hide. Some of the eye tracking, you can't hide that. And the balance, the cognitive screenings and things that you do, those are hard to hide. And so it's really difficult nowadays to surpass these testings and break through if you truly did have a concussion.
There's a piece of video circulating online of what appears to be a trainer handing Josh Allen smelling salts. Can you explain kind of what smelling salts does and what would allow him to, again, if he was a little bit fuzzy or whatever, how that would help him go back in the game and perform?
Sure. I mean, the short answer of it is I'm not sure that it would help very much at all. I've had this question a lot in the last couple of days, actually. And so it is a bit of a, I don't even know if I want to say controversial subject, because the research has shown that it is not really that beneficial in people who have concussions. What smelling salts are is that it contains ammonia, and so smelling that, it irritates your nose, it irritates your lungs. It triggers this breathing reflex that can help someone regain consciousness after something like fainting. And so it triggers them to start breathing deeper and faster. It increases their heart rate for a very short period of time, but it helps increase the oxygen delivery to tissues. So concussions, they're caused by a brain injury and not oxygen deprivation. So in the case of fainting, so if someone goes and gets their blood drawn and they faint, that's from oxygen deprivation, and smelling salts can help in that instance. So using the smelling salts for concussion, as a treatment to make them more alert, that's not how it works. So I can't speak as to why, they were using it, or I think that, you see it. I've seen it on TV on sidelines for a lot of different things. I'm not sure there's evidence behind any of that for it to be especially helpful. But yeah, so like I said, it's the mechanism is not going to help people who have acute concussions.
All right, let's move on to another quarterback in the league, Tua Tagovailoa, and I'm sure you've answered a lot of questions about his situation as well. The NFL has come out and said that they don't plan to step in on this decision about if he'll be allowed to return, when he'll be allowed to return, so on and so forth. And it sounds like he is on pace to start practicing again. He said publicly that he does not plan to retire. Are you surprised, given how the league says that it's all about player safety? Are you surprised that the league is not stepping in and I guess assisting in the decision-making process here?
I don't know, frankly, if I'm surprised or not, but I think, again, it's tough to know what those conversations are like behind closed doors, what his physical exam symptoms are, or signs are, what his symptoms he's reporting are, how he's gone through his protocols, how he's gone through his treatments, what treatments he has had to do. And there's still a lot that isn't known about the long-term effects of concussions. We certainly see instances where, it looks like they're playing a significant role in certain things, but, lot of unknowns. And so medical retirement, as we kind of call it, is a very, very difficult conversation to have with an athlete. And so it's a situation where, as a medical doctor, you say, are you at risk for XYZ down the road here? Playing a contact sport like football, you're at risk for a lot of things down the road, and not all of them you can control. Frankly, most of them you can't. And so this is a conversation, and this is a decision that, you really have to make with people who you trust to give you good advice, people who, your family members, your coaches, your trainers, healthcare doctor, professionals, people familiar with concussions. And ultimately, you come up with a risk-benefit analysis of what is best for you and what you want for yourself in the long run. And so kind of a general answer, but it's, like I said, there's a lot of factors that go into it. And so, I'm, in a way, I'm glad that the NFL is kind of keeping distance from it from that perspective, because it's such an intimate conversation that I don't think it's meant for people who aren't close to this person personally and from a medical standpoint close to them.
Yeah, that makes a lot of sense. And one more question that I have in regards to concussion protocol. Does a player's past concussion history play into concussion protocol? When you're, obviously we know Tua, going into this third one, he had 2 diagnosed concussions in the NFL. Does that play into how you're evaluated on the field and then I guess treatment, after that?
It certainly plays a role in the overall health of that athlete. We need to know how many they've had. One of the important questions is, when was the last one? How was it treated? And how long did it take for you to complete that full recovery? Was it a week? Was it 2 weeks? Was it 3 months? Those are very different timelines. And so the way we evaluate, however, is pretty standard. When you have repeated concussions, we know that it will be additive after a certain amount of concussions. That number after which it becomes more additive is not really well known. And so certainly the more you have, the longer it can take to recover, the more severe your symptoms can be, the less likely you'll be able to hide your symptoms if that's, a concern. And so, it's something that definitely plays a role, and it's something where we may consider pulling the trigger on other types of therapies earlier in certain people who have a history of longer recoveries. And so things, different types of physical therapies, vestibular therapies, speech, vision, cognitive therapies, we have all of these types of modalities kind of in our toolbox that we can use. Not everyone needs them all. And sometimes some people only need 1 or 2 of them. But people who have the prolonged history of prolonged symptoms, because maybe they've had multiple concussions that have been pretty complicated to treat, so that plays a role in more so how we think about their treatment course, but not necessarily in how we diagnose them.
This may be a dumb question, but I'm going to ask it anyway. If I think back to like Tua or like a Jerry Cooney in boxing, is it every time are you concussed if you get knocked out immediately? Is that, are they one and the same thing?
By definition, and I don't know if this has always been the definition, but by definition now, if you have had a loss of consciousness, it's considered a concussion.
Okay, that's what I was wondering, because I've seen boxers that go careers and get knocked out 15, 20 times, so they would have been concussed that many times.
Man, yeah,
that's crazy.
Yeah. That is crazy to think about.
Yeah, it is.
Man, it's such a serious topic, such a complicated topic. Dr. Plante, thanks so much for your time. Really informative stuff. We appreciate you having you coming on and giving us some of your time. Thanks so much, and we look forward to talking with you again down the road.
All right, guys. Thanks for having me. Nice to talk to you.
All right, Dr. Kyle Plante from SOS joining us here. And with that, we will take a timeout. 315-437-7644 is the number if you'd like to get involved. Max Goodman, Yankee.
No, because that's